Good day. My name is Rana Ibrahim, and I'm the Obesity Case Manager at Johns Hopkins Aramco Healthcare. In our Obesity Care Management Clinic, we empower people to change their lifestyle by educating them about healthy lifestyle changes and raising the awareness that will help them change their behaviors in order to lose weight and prevent chronic diseases, which will ultimately lead them to optimize their health to have a better life. Tackling obesity is one of the greatest long-term problems that this country and every other country are facing. Obesity is a major health problem across the world. Obesity is associated with reduced life expectancy. It is a risk factor for a range of chronic diseases, which we'll be discussing in the coming slides. Worryingly, since the beginning of COVID-19 pandemic, it has been proven consistently that having like being overweight or being obese increase the risk of being hospitalized or being in the ICU than from having COVID-19 with a normal body weight. Let's talk about some facts about obesity around the world first. Recent WHO global estimates show that obesity has nearly tripled since 1975 worldwide. Studies have shown in 2016 that more than 650 million adults aged 18 years and above were obese. That means 13% of the adult population. Also, in 2016, 340 million children and adolescents aged 5 to 19 were overweight or obese. In a recent study done in 2020, 39 million of children under the age of 5 were overweight or obese. Once this issue, being obese or overweight, used to be considered as a problem in high-income countries, but now it's on the rise in low and middle countries, particularly in cities. Even in Africa, numbers of obese children has increased by 24% since 2000. Obesity and being overweight are linked to more deaths worldwide than being underweight. Globally, there are more people who are obese than underweight. This occurs in every region except in some parts of the sub-Saharan Africa or Asia. Obesity is preventable. Let's talk about the facts in Saudi Arabia. In Saudi Arabia, a national survey conducted between 1995 and 2000 found that the overall prevalence of obesity among Saudi adults was 35.6%. That was for men was 26%, and for women it was 44%. Another study, another national study that was conducted in 2013 showed an obesity prevalence of 28.7%, men 24.1%, and women 33.5%, which indicates a decrease in the obesity trend in the kingdom. The latest study that was conducted in 2019 to see how many people were obese and how many were overweight. This study was conducted over the phone. It was phone interviews, and people were asked to provide their height, weight, and BMIs. And this study has shown another decrease in the prevalence of obesity in Saudi Arabia. 20.22 adults were obese, which is shown in the blue part. 19.2% were men, and 21.4% were women. And the gray shows the overweight people. 38.2% adults were overweight, 42.7% were men, and 32.7% were women. There is no significant justification on why this decrease has happened, but there is a lot of laws that was implemented since 2017 in Saudi Arabia. So this shows a good trend in becoming healthier, but we still need more. So some policies changes that have happened since 2017 helped people become healthier. Some keystone changes that happened was passing law allowing female gyms to open across Saudi Arabia. The introduction of physical activity in female schools. The government initiated the quality of life programs as part of the Vision 2030 plan, which included programs and resources to encourage people participation in exercise as well as healthy lifestyle by opening up walking tracks for everyone. The initiating of the law that allowed the restaurant to put the amount of calories in each meal, that really helped and increased awareness in the Saudi community. They also introduced 50% taxes on sugar sweetened beverage and 100% taxes on energy drinks. Although this didn't show yet a big change in the matter of consumption of these products, but this will show a big change on the long run. So what is obesity? Obesity is an excess accumulation of fat that may impair health. It's the result of an imbalance between our food consumption and our food burning. That means we eat more than we burn. It's measured by the MBI by the BMI, being above 30. And I will be talking more about the BMI in the next slides. What are the causes of obesity? The fundamental cause of obesity that is very well known is the energy imbalance between the food we are taking and the food we are burning. So we are taking more calories than our body requires. Another cause is pregnancy. Pregnant women have difficulties in losing weight after childbirth because it could be different reasons like stress, lack of sleep, not being able to exercise because they have to take care of the baby. Some would have postpartum depression, emotional and psychological factors like stress, depression, low self-esteem, certain medical conditions, and drug-induced obesity. Like some antidepressant medications can prevent weight loss. Genetic factors are a big cause because families tend to share the same habits and lifestyle eating. Lack of sleep, and it's a big issue here in Saudi Arabia, especially during vacation times, where people tend to stay awake all night and sleep all the day, which will create an imbalance in the appetite and the hormones that control appetite. And that is a big reason that can stand in front of the way of losing weight. So sleeping so to have 6 to 7 hours per night sleep is very important in the weight loss process. Our sedentary lifestyle and the decrease in physical activity is a big problem also, and it depends on our work schedule, some people work shifts, 12 hours, 7 days in a row. Sometimes it's a lack of time. We have a lot of responsibilities, which lead us also to the biggest cause of obesity, the environment cause. The environmental cause is a big cause of obesity. As we know, and as we've all experienced, a lot of people are trying to lose weight, and they want to lose weight, but they struggle because of all the environment factors around us, from commercials, like let's say we are unavoidable, like the unavoidable unhealthy food adverts. We're watching YouTube, we're watching a movie, we're watching a documentary. The fast food commercials keep popping up with also promotions, and they encourage people to buy, and it keeps pop up several times, and the more it pop-ups, it encourages people to eat it. The supermarket deals, like having let's say 2 chocolate bars and 1 free, or having a package for the price of 1. Some confusing food labels where they will say it's fat free, but if we actually read the food label, it has a lot of sugar in it, or same as no sugar, but it's high in carbohydrate. Fried chicken, fast food on the go. We finish work late, we're tired, we're stressed, we don't have time to cook. We just pick the easy solution, which is drive-through. 5 minutes, we get our food, we eat, which is high in calories, and it's also free. A lot of healthy food is also expensive, which makes it hard for people to actually buy it. So they go to the fast food option. Also, the supermarket deals the bigger portions, like you can get a bigger portion for the same price of a smaller one, or slightly higher, which makes it good for a big family or even a smaller family, but this way they will save money. So our also sedentary lifestyle that is induced by the demanding work schedule, as I said before, working long hours, working shifts, having 7 days of week, working 12 hours, will make it really hard to exercise. One more very important factor also is the high cost of gym membership. Although there is gyms everywhere now, fitness centers, but it's very expensive. Some of these gyms, you have to pay like almost half of your salary or more, and a lot of people can't afford it. So that's the environmental factor in the obesity is very big. So what are the risks that we talked that obesity will cause, or overweight? We have known for decades that being obese or overweight will decrease the life expectancy, and it will increase the chance of having chronic diseases such as heart disease and strokes, diabetes type 2, dyslipidemia or high cholesterol, cancer risks, mood disorders, liver disease, reproductive disorders, and breathing disorders such as sleep apnea. But the last 2 years also, it has shown that the COVID-19 pandemic showed that being overweight or obese can increase the COVID-19 symptoms and also its complications later. And those risks will increase every time the BMI increases. Now, to understand the body composition, a simple way we use it's the BMI. Height and weight are very important and the most useful information and measures to monitor the body nutritional status, and to see if someone is underweight or in the healthy weight range, or overweight or obese. The BMI is calculated by having the weight divided by height times 2. So what we use in the clinic is the Tamita body composition analyzer, and we also, before the patient actually step in on the weight scale, we have to set up the age, height, and the gender. And then the paper you're seeing is the paper that we will get from the weight scale after the patient steps down from it. So, as I said, the BMI is the measure to know if someone is underweight. The BMI, the example here is all normal. When BMI is less than 18.5, this is considered underweight. Healthy weight is considered between 18.5 to 24.9. When we are over 25 to 29.9, we are considered overweight. Obesity class 1 is considered from 30 to 34.9. Obesity class 2 is from 35 to 39.9, and above 40 is morbid obesity that can lead to chronic diseases, as we mentioned, diabetes, hypertension, cholesterol. So other factors that we can see from the body composition analyzer is the BMR. The BMR is the base metabolic rate. The number of calories, it's the number of calories you burn each day just to stay alive. It does not include any physical activity. The other factor that is really important that we focus on is the fat percentage and the fat mass. How do we know if someone is in the healthy range? We look at the fat percentage of the person, which is here 13.1%. But we look down at the desirable range. It should be between 8 and 20%, and this differs from one person to another. So here it's considered it's in the normal range. Same with the fat mass. It's 9.6 kilogram here, and the desirable range is between 5.5 and 15.9 kilogram. One more thing we look at is the fat-free mass, FFM. It's the weight of everything else in your body, muscle, bones, organs, tissue. It shows if this is very important to see if your muscles are strong or not. And this has to stay the same or increase in the monthly visits. Total body water, TBW, is the amount of water in your body that your body currently holds based on the FFM. So we look at the total body water. For men, it should be 50% of the weight. If it is in the 50% of the weight, this is considered good because it shows that the muscles are strong. And for women, it's 55% of the weight. So if it is less than this, that means that the person is not exercising enough and they need to exercise to have a stronger muscle mass. Another important thing that is not measured by BMI is the waist size, or what is called abdominal fat. It's the fat around the middle that we need to measure also to see if someone is obese or not. For women, it has to be less than 35. 35 and above is considered obese. And the more that it increases, it increases the risk of having heart diseases and other chronic disease. In men, it should be less than 40. More than 40 is considered high risk. So what can you do? What can we all do? What should we do? The first and most important thing is we have to change our dietary habits. We have to introduce physical activity in our daily life. This will have, we will have to make big behavioral changes to our daily life. Supportive environment, our communities are very important and are fundamental in shaping our choices for healthier lifestyle, for a healthy choice in daily food. So this is, as I said, really depend on the environmental factor, which is the commercials and whatever we talk about. So the healthiest choices that we can be helped to make and make it more accessible, cheaper, and easy access. This is how the environment, supportive environment, can help us in doing a big change. As individuals, we have to limit our intake of total fat and sugar. We have to increase our consumptions in having more legumes, vegetables, fruits, and whole grains. We normally at the clinic use the My Plate, so it's a balanced quantity and quality of healthy cooked food divided per day, 3 meals and 3 snacks. We talk in details about that in the clinic. We have to engage in a physical activity almost daily for 45 minutes. So we have to be role models at home to be able to introduce that change to our kids also, because our kids are the future adults who can be obese or not. So it's our responsibility and it's our job to create and help having a new healthy generation. The food industry also have a big role in reducing the fat, sugar, and salt content in the processed foods, and ensuring that the healthy and nutritious choices are available and affordable to everyone. Restricting marketing of foods high in sugar, salt, and fats, as we talked about the marketing, commercials, YouTube, TV, especially all those food that comes with promotions and aimed for children and adolescents that can be paid from their pocket money given by the parents. Ensuring the availability of healthy food choices and supporting regular physical activity practice also in workplace is very important. So what do we do in the obesity care management clinic? In the outpatient obesity clinic in Dahran, we see patients who wants to lose weight, who wants to make lifestyle changes to prevent chronic diseases. So we see patients who are pre-diabetic, we see patients with dyslipidemia, high cholesterol, and we also see patients who are overweight and obese who wants to make the lifestyle changes in medically by changing their lifestyle habits, exercising more. We follow up with them monthly, and we give them all the support and the education they need in order to reach the target they want. We have 2 pathways, one medical, as I just explained, and another one is surgical for patients who are interested in having the bariatric surgery. According to eligibility and requirements, we can, which is BMI above 40 or BMI above 35 for patients who have chronic diseases. We can refer them to the bariatric coordinator and then help them explain the process, how long it takes, and help them to lose some weight before the surgery in order to have a better surgery outcome. And the obesity care management clinic is located in building 50, primary care behind the reception, room 203-5. How to book an appointment in our clinic? You can ask your doctor for a referral if your BMI is more than 30, and book your appointment at the reception or call 870-3888. Globally, as we spoke before, the obesity numbers are increasing, and especially in adults, and is expected to reach 3 billion by 2030. Although most of the countries are taking all the actions to level off the obesity and childhood obesity, we still have a big responsibility as individuals. We have to act now, take action now, choose to move more, choose to eat healthier, choose to have a healthy weight, choose to ignore all the what we call negative cues like the commercials or fast food marketings. Just try to have a daily schedule of exercising and being more active, and have healthy choices even when we go to restaurants. It's our responsibility to be aware, spread awareness, and work towards achieving the best outcome, which is creating a healthier community in order to have a better community and to help lessen the burden, the economical burden in our country. So, as I said, take action now. Everybody needs everybody. We have to stick together in order to have a new generation that is healthier and lead in a healthier way. So everybody needs everybody. Thank you and have a great day.